Even though the healthcare debate in this country is largely over, there is still plenty of disagreement over whether we are headed in the right direction. But the one point virtually everyone agrees on is that there are not enough primary care doctors to meet current needs. And that is before nearly 50 million more people will be thrown into the mix with the new healthcare law now in place. I talked about the looming crisis with Dr. Andrew Singer, an internist and founder of Primary Care Progress, a group of healthcare professionals committed to trying to reform the system, and Dr. Shoma Stout, who is president of the medical staff of Cambridge Health Alliance. Take a listen. Dr. Andrew Singer and Dr. Shoma Stout, welcome to both of you.
Thank you.
Thank you.
Shoma, let me start with you. We talked about this a lot during the healthcare debate in this country, that this influx of newly insured people was going to put more pressure on the system where there's already a shortage of primary care doctors. Talk to me about the problem. How big of a crisis is this really?
So, Campbell, unfortunately, what we're facing in primary care right now is what I could only call a perfect storm. First of all, medical students and residents just don't want to go into primary care anymore because when they look and see their mentors in primary care, they see that the job is completely unsustainable, largely because of a payment system that doesn't really reward or value what primary care providers do.
If the system, the payment system, is so dysfunctional, explain why doctors get paid this way and why we aren't compensating primary care doctors better.
First of all, we actually don't pay for a lot of the really valuable services that they do provide. For instance, coordinating care, all those behind-the-scenes activities that your provider's doing so you don't fall through the cracks,
right.
Those aren't paid for. The only thing that really gets paid for in our system are those face-to-face visits when a patient is meeting their provider one-on-one. But the payments are really inadequate right now. And then medical students who are rotating through these practices are watching this and saying, I don't know if I want to do this. So the payment system's not working for patients. It's making providers crazy, and it's kind of discouraging some of the medical students from going into primary care services.
So, Shoma, how do we fix it?
Well, that's a great question, maybe the billion-dollar question that we face. I think that part of what we need to do is fix some of the disparities. So the average medical student with a $250,000 debt looks at going into primary care and sees that they're going to make $3 million less during their professional career and says, why am I going to work this hard to make this much less? The other half, though, is I think we need to figure out how to make primary care meaningful and rewarding for people who are doing it so that the medical student or resident, like as Andrew was recently, looks at their preceptor and says, that's the kind of job that's so meaningful that I want to do it. And the really exciting thing is that increasingly across the country, there are hundreds of experiments going on that are looking at paying primary care providers differently.
So let's talk about that, these new models of care, because we hear a lot about it, and to the average person, the average patient, we don't understand what you're really talking about.
One of the things that we found in these new models is that sometimes it doesn't make total sense to make a patient take a half day off work just to come in to have a simple question answered, right, about a medication or a rash that hasn't gone away in a few weeks. Sometimes it makes a lot more sense to have access to the provider via email or telephone, and patients love it because they don't have to take time off work. They don't have to go park and then walk to the office, and they feel like they have much better contact with their providers. And that's one example.
And I know you guys care very passionate about this. You care a lot about it. You've been working very closely with Harvard on brainstorming on all of this stuff, I know. And you, Andrew, have formed an organization to try to put a lot of these issues on people's radars. Really, the next step in healthcare reform is what we're talking about. Tell me about it.
So what we did is we formed this group called Primary Care Progress. And one of the things that we're trying to do is really ensure that all Americans understand why primary health care is so important. We think one of the problems is that people just haven't really appreciated to date why this is such a critical thing for our medical system. And we're engaging patients and providers in sort of identifying what does really valuable primary care look like. Because we know we have some ideas, but we think patients and providers are going to have some of the best ideas. And so we've established a website where we're actually asking people to come by and tell us what they think. And we're also working to engage this next generation of primary care providers in this process of transforming care and transforming the way we train. Because we actually think that they have skills and experiences that they're going to bring to bear that are only going to make patient care better.
Right. Well, best of luck to both of you, because we are certainly in this country in a very transitional phase right now and are going to need all the help we can get in terms of getting people ready for this transition. And Dr. Andrew Singer and Dr. Shoma Stout, good to have you here. Appreciate it.
Thank you so much.
Thanks for having us, Campbell.
Campbell, it's a pleasure.